Welcome to Doing the Work, Frontline Stories of Social Change, where we bring you stories of real people working to address real issues. I am your host, Shimon Cohen. Thank you to FIU's Disability Resource Center for providing transcription services. In this episode, I talk with Brenton Gicker and Chelsea Swift of CAHOOTS, Crisis Assistance Helping Out on the Streets, a 24/7 mobile crisis intervention program of the Whitebird Clinic in Eugene, Oregon. CAHOOTS, which pairs a mental health crisis worker and a medic in a big white van, has been receiving national attention as a model for a crisis response alternative to the police or fire department. Chelsea and Brenton share what a typical shift is like for them and how 911 calls are routed to them rather than the police for certain situations. We discuss the cost-effective approach of CAHOOTS, as well as the humanitarian benefits, such as de-escalation and fewer arrests, by utilizing the skills of medical and mental health professionals rather than the police. Brenton and Chelsea both share how they got into this work and how they began as crisis workers and then each decided to become medics. Brenton, a registered nurse, and Chelsea, an emergency medical technician. I hope this conversation inspires you to action. Hey, Brenton. Hey, Chelsea. Thanks for coming on the podcast. Let's just get right into it. Can you take us through what it's like to go on a shift with you two?
Well, I usually work 12-hour shifts, and oftentimes, you go in service. Like what'll happen is me and my partner will go to our base and get our equipment ready to make sure the van is stocked properly, make sure we have the equipment we that our equipment is ready to use, and we use police radios. We're dispatched by the same people that dispatch the police and the fire department, so we'll put ourselves in service, let them know that we're available. And a lot of times you come in service and, there might be a stack of calls holding, and so that can be stressful, because you don't want people to have to wait longer than you want them to. You don't want calls that should be handled by CAHOOTS to end up getting handled by the police or the fire department because we're not, immediately available. So there's this kind of triaging that goes on, and it can be kind of a frenzy. There was a reporter from the Salem Reporter that did a story this week about CAHOOTS and his ride along, and I think that his shift with us, I think, was a good kind of representation of how a shift can go. Our it wasn't too hectic, but we had a steady flow of calls, and we had some good calls. But the first one involved a woman who was having some paranoia and anxiety. She thought the neighbor above her, he can be kind of loud or whatever. And she felt like he was intentionally trying to torment her by stomping around and stuff. I don't think that was actually the case, but she'd called the police to try to make a noise complaint. And I think because the police had dealt with this woman before, they're basically you're not really reporting a crime, and we think you have some emotional problems. So we're going to send CAHOOTS to talk to you. And she's familiar with us, so she's okay with that. She's okay with, getting a response from us, makes her feel better. It doesn't make her feel dismissed necessarily, So we came out to talk to her, and, and of course the issue with the neighbor is just a piece of what's going on. She has all these other issues she's struggling with, so we come out and kind of talk to her and problem solve with her, and, talk about coping skills with her, and, ways she can, distract herself or maybe put her energy elsewhere, that kind of thing. So you have a call like that, and then maybe the next call was a higher intensity call where you have a woman on a bridge, threatening to jump off of it to kill herself. And the police responded, and we responded, and, ended up taking the woman to the hospital because she seemed like she was pretty, imminently dangerous. And, and then it just goes from there. Then the next call is checking on an elderly woman in her apartment because she called 911 sounding confused. Maybe she has some health problems or some mental health problems. And, so we get sent out to check on her, make sure she's doing okay, kind of talk to her about what's going on. And then our next call might be to check on a homeless alcoholic who's passed out in a field, and, and somebody saw them and thought they might need help. And so we get sent to check on them. Maybe we just make sure they're all right. Maybe we end up taking them to the emergency room or the detox center, that can go a lot of different directions. But yeah, so we respond to a lot of different types of calls, that come into the 911 system that really might be better addressed by a service like ours than the police or EMS.
So, okay, so the calls come in through 911. So you've got this relationship, and I know that the organization goes back something like 30 years, right?
Yeah.
Can you talk a little bit about that history and how you and the police work together, but also there's kind of different goals, even though overall some of the goals are the same?
Yeah, so CAHOOTS is a Department of Whitebird clinic, which started in the late 60s. A bunch of college students from the University of Oregon and doctors started this collective environment for people to enable themselves to get their needs met. And that became a place that, even though the landscape was kind of different, people were on the streets but using different substances. They were brought to Whitebird by community members and by police. So that was kind of always this bizarre function of Whitebird Clinic, which grew to have a medical clinic and a dental clinic and counseling and outpatient drug and alcohol treatment, just building on like, okay, we're kind of doing this radical alternative way, and we're good at it. So we're going to keep meeting their needs. And one of the services that we've had every day since Whitebird has been open since 1969 is our 24-hour crisis phone line and drop-in center. And that team in official and unofficial capacities and station wagons and became the Bummer Squad, who would go out to some folks who, like a lot of the people call the crisis line, who've maybe never engaged in mental health systems whatsoever. Or maybe so many of their barriers are due to agoraphobia and not leaving the house, or institutional trauma of they go to try to get their needs met at the hospital and it goes really poorly. And now it's going to take years for them to even get there again. So the Bummer Squad from the crisis department started going out and meeting with folks. And that reputation, combined with the fact that the police were already bringing a lot of people who were maybe having a bad psychedelic experience in public, or were not appropriate for the jail or hospital, they took funding and diverted it from hiring new police officers in 1989 and gave that funding to put a CAHOOTS van on the road, which I believe started as either one 8-hour shift for like 5 days a week, or maybe it started off as a 12-hour shift. Now we operate 31 hours in a 24-hour period in Eugene. We've expanded to the smaller city next to us, Springfield, where we run a 24-hour service. And there's so much that comes with being integrated with the non-emergency number being how you access CAHOOTS. But I think what's really cool about a lot of the examples that Brenton gave just now is like, those calls did not come in as organic, hello, I would like CAHOOTS to respond. Those were calls that somebody called 911. And so often, like, people's predicaments are not necessarily an emergency of safety, but it's an emergency of a resource crisis. That's an emergency for them. So they call 911. And because we are this official part of like that triaging system, this could go to the fire department, this could go to police, or this could go to CAHOOTS. We are just as much of a considered option. Like, that is where we really get to see the full capacity of what it looks like for non-enforcement response. Because we could have this crisis line and some people would access it, but the reality is this, like, and especially in marginalized communities where maybe they run out of minutes and the only number they can dial is 911 on their phone, like, we are conditioned to call 911. People who see somebody being weird on the street, they're not going to Google a crisis line, they're going to call 911. So being a part of that system lets us catch those things that would be better handled by us.
Yeah, I want to talk more about that. So, you know, that article that came out and a lot of the discussions about this type of crisis response talks about the economic savings to communities, right? For having this type and not having to Like there's a statistic here that, Eugene, Oregon saves between 6 and 7 million annually by contracting with CAHOOTS, and that the police department's budget is 60 million versus CAHOOTS budget, which is 1.6 million, right? But what and that's great. I think, because taxpayers, right, they want more bang for their buck. Like money's important, right? Funding is important. What's also important, and I know is important to both of you, is decriminalization of homelessness, people with mental health issues ending up in jail and lives being saved. So I want to just read some statistics to you and get your response thinking about the work you do and how it relates to this. This is from the National Alliance on Mental Illness, NAMI. They say, that, of course, when people have a mental health crisis, they're more likely to actually encounter police than get medical help. And that 2 million people with mental illness are booked into jails each year, nationally, right? 15% of men and 30% of women booked into jails have a serious mental health condition. And 83% of jail inmates with a mental illness did not have access to needed treatment. 83%. That's almost all of them, right? And then they end up with a criminal record, or more of a record than they maybe already had, which then becomes a barrier to employment, right? And the cycle of crisis and marginalization continues. So I was hoping you could speak to that in the work you do.
Yeah, Oregon actually pretty consistently ranks the worst in the nation for accessibility of mental health and addiction services. So, it's really bad here. There are good people doing good work, obviously, but there are just huge deficits, and so I guess one thing, something that Chelsea said a while ago, that I thought was insightful, is that she was at a meeting there was police and business owners and social service providers and different people talking about these problems, and to some extent, everybody's kind of been signed up for something they didn't mean to sign up for. Like the police, sometimes it's easy to imagine the police out just hassling mentally ill people or something. And I'm not saying that never happens, but to a large extent, the police are dealing with all these people and, who they maybe don't feel prepared to deal with, or, didn't they didn't get involved in police work to deal with, people having mental health problems. But it's become this huge part of their work precisely because the mental health system itself is so broken. So cops, taking a mentally ill person to jail or whatever, it's not necessarily because they, want to, persecute the person. It's because they're not sure what else to do with them because the resources that person should have just aren't available. So there is this as the mental health system and services for homeless people and addiction treatment services have been defunded, the kind of responsibility for dealing with those people has been transferred to the police and emergency medical services, who are just constantly who are just putting out fires.
Yeah, there's no waiting list for 911. Right. You will get a response. And not sometimes, most of the time, people just need to be heard and validated, and they want someone to show up on their doorstep when a single mom is exasperated and her 6-year-old has gotten a butter knife and is threatening with her. She might call 911. And does she want her 6-year-old to be incarcerated? Usually not. But she has no other option because good community care is not focused on. And a way that I always frame this, which for me is objective, but maybe not for other folks, is I started this work as a crisis worker, and in the last year I became an EMT, which is kind of a path I never expected to be on. But when I was showing up as a crisis worker, I had to bring every tool within myself. My problem solving, my ability to interact with people in crisis, my ability to use my privilege to interact with the police on behalf of folks, my ability to kind of problem solve between families who are fighting. Those were my tools. And now that I'm an EMT, I have a couple of other medications and tools that I can use. But then when we think outwardly, if we're trying to think of a solution on a call that has come in through a 911 dispatch center, we get to consider the hospital. We get to consider shelters, youth shelters, crisis centers, medical clinics, urgent care. So those are our tools outwardly. Police, when they think of the tools that they have on them, they're like, oh, I have me. And then I have my taser, and then I have my gun, and I have my body camera, and I have a long rifle in the car, and I can call for cover. And like, if it gets really wild, we could get the Bearcat out, right? They have like all these tools that, like me, I'm excited to Narcan someone. So if I think that's about to happen, I'm going to like get the stuff ready in the van and come out on the call ready for it. So they have different tools, and then their tools outwardly are much more limited. It's jail, hospital, or inaction. So looking at it that way, just when the outcomes are that limited, it gets the risk and the violence and the lack of solutions beyond just solving a situation in the moment. Just that is not an option that is there.
Speaking to, you were talking about the article and the emphasis on economics and the cost saving and stuff. I think one thing that's really cool about CAHOOTS, and because, realistically, when we have to accept the fact that like on some level, like we're all stuck with each other, like in our society, like there's a bunch of people with conflicting interests, conflicting views, and we're all kind of stuck with each other. And so we have to sort of like navigate that and sort of reconcile that, without, compromising who we are and what our values are, but also just accepting that there's a bunch of different people with different interests and different needs and different views. So like with CAHOOTS, like let's say, for example, like somebody calls 911 saying they're going to kill themselves, but they're, they don't have a gun to their head. They don't have a noose around their neck. They're just really upset and they want somebody to come to their aid. You send CAHOOTS instead of the police. You're saving the taxpayer money. So the people that, aren't concerned about the welfare of the mentally ill, they can say, oh, well, that's good. That they're sending CAHOOTS instead of the police because the CAHOOTS is cheaper. Also, if the police go and they have a bad interaction with this person and it results in that person getting hurt, that could result in lawsuits for the city. That could, from a humanitarian perspective, we might be preventing somebody from getting hurt. We might be, providing the care that's like, really kind of more appropriate for the circumstances. But, for those people that are more concerned about, the fiscal conservatives, the people that, are concerned about, what their tax dollars are being spent on, can know that, oh, well, actually, like CAHOOTS is saving the community money in these like myriad of ways. So I think there's actually like the humanitarian and the like, economic interests actually like are complementary. Not they're not opposing each other. So I think a lot of people can get behind CAHOOTS, like just on no matter where they're coming from.
Yeah, absolutely. I mean, there's really no reason why every community and especially every major city should not have this type of program, and that is probably why a lot of places are talking about this kind of work. And I'm sure I don't know if people consult with you about this or how that works, but it's like. You're right. Like all those interests can align with this, and it's really something that should be like a win-win for everybody.
Right, because in a lot of these situations too, like say we handle a call, we either relieve the police on a call or we respond to a call like in lieu of them. They're freed up to do something they want to do. They're instead of responding to a call they don't want to respond to, they're doing something they want to do. While we're getting to do what we want to do. So we get to. Usually if we can keep the police out of things or the fire department out of things, usually everybody's happy about it. We're happy about it. The client's happy about it. The other agencies are happy about it. It is kind of a win-win scenario most of the time.
Yeah. And as far as like so many cities have been reaching out, and I've been involved with some of the work with some of the bigger cities which has been so valuable too, because talking and giving presentations in Oakland and Baltimore and teleconferencing with people in New York City, like we're not perfect. We have a lot to learn. And in those cities, there's a bit more urgency. And what already exists in those cities is maybe just pure mental health teams. responding as an alternative crisis response, or the co-responder model is really popular and exists in a lot of places right now, which is a clinician, a mental health clinician, and an officer in a patrol vehicle. And yeah, you're going to get more skills on scene. So back to the tools that are there, that's going to look different, but you still have a police officer in uniform showing up to a call. You still have the only transport option of a police vehicle. You still have the cost of an officer and the cost of like a psychiatrist or a higher level than we are on crisis workers. And that can mean a lot of things in terms of like experience and licensure. But our model is very unique and not yet replicated as far as like I'm aware in this work because we work with the crisis worker medic duo. So an example of how our model gets very magical is a call that I remember from my first training shift ever 3 years ago, where police were sent for a prowler in a neighborhood for a woman who was knocking on doors. And she got called in as trying to force entry. She got a police response. She was very clearly psychotic. So they were like, cool, let's get CAHOOTS to try to see what they can offer, see if they can help come up with this solution. And this woman was presenting very much mental health issues. So the crisis worker got in there and was trying to de-escalate, trying to do some problem solving. And then the medic partner on shift looks on top of her refrigerator, sees a bottle of antibiotics, pours it out, realizes, nope, none of the pills have been taken. It was prescribed 3 days ago. And he was like, oh, you mentioned you've been smelling differently. Is it possible that you have a urinary tract infection? And like out of the deep psychotic state, she was able to confirm that. And so that was like a medical issue causing a mental health presentation that came in as a criminal call.
Wow. And that is your work right there. I mean, that is such a great example of she could have ended up in jail. Like in most towns and cities and communities, she would have been in jail.
She could end up getting shot by a homeowner.
Right. Breaking into a home and getting shot on site.
Yeah, that whole situation could have really escalated into something ugly.
Yeah, that's really good teamwork to have all that come together like that. I mean, that's incredible.
It also like is what kind of gives us access within this EMS and emergency medicine world that we operate in, because that also looks like when we are transporting someone to the hospital, because we have the medical knowledge, we can consult with a doctor, and oftentimes we can get folks directly admitted, the same as when the police bring somebody on a mental health hold, they bring them straight back to the secure side of the emergency room. When the fire department brings somebody in on an ambulance on a stretcher, they get somebody right into a medical room. So this like very professional experience model, we are able to access a lot of those same things and not just be like a peer support worker sitting with somebody in the ER lobby for 2 hours until they get seen, which is so important too. But how we kind of move on beyond that scope.
Yeah, I wanted to ask you both about your training. Chelsea, you mentioned that you've become an EMT, but you started as a crisis worker. How did that kind of go? And what was that original training like? And then how have things kind of progressed?
My work started off in the Haight-Ashbury in San Francisco. I was selling Doc Martens to all the cool punks who worked at the needle exchange across the street. And I started volunteering in the drop-in there, running showers for all the crust punks and trained traveling kids and deadheads. And then I got hired on as an outreach counselor. And while I worked there, we lost our drop-in. We were actually kicked out by the founder of the Haight-Ashbury Free Clinic. And we became the Homeless Youth Alliance and San Francisco Needle Exchange. And all of our work was on the streets. So we did outreach in Golden Gate Park and on Haight Street, and like super harm reduction. We're going to work with you on what you want to work with. And a lot of that just looked like conversations in the park and granola bars. And then I moved up to Eugene just due to San Francisco not being the most sustainable place to live in the world when you're in college, being an outreach worker for, that population. And found Whitebird Clinic, and I was like, whoa, okay, so this is kind of what I expected to find when I moved to San Francisco, that being like the hippie, weird collective that Whitebird Clinic is. And I ran the needle exchange here in town in Eugene for a little bit. And I had some hesitance with working with CAHOOTS because I came into this work in San Francisco where stakes were kind of higher, and police would walk up to me in the park and be like, hello, are you the agency who hands out needles in the park? And we would say, no, goodbye, sir, as I walk away with my bag full of needles in the park. And my clients there were very, very, very much impacted by like aggressive policing every morning. And then I kind of had this head switch where I was like, this job exists. I'm in this town. I'm working with this population. I'm doing case management at Whitebird Clinic while running the needle exchange. And I don't have a lot of trauma around police work yet. That would come after. And I just felt really called to like access the fact that I had these skills and experience, and what does it look like for somebody like me to hold this role. And so a lot of my experience of kind of working with people in non-traditional environments and people with all sorts of mental health presentations, socioeconomic backgrounds, super like cross-cultural work, was really helpful. And then I just like had to learn the really important stuff like counseling skills, which kind of hilariously came last. And then through seeing calls like that one I described, it was like, well, if I'm doing this work, I'm good at it. Like I feel so powerful about when I'm able to walk into a scene and there's 3 cops and 6 firefighters and they're kind of amped up and saying like, we don't know what to do. And I walk on scene and I'm like, oh, hey, Joe, come on, get in the van. Like, see you later, boys. If there were ways that I could keep like building my power to advocate for people, I became an EMT. So
that's an awesome story. I love it. So you just kept increasing, what you were doing and your skills to really be there for people who need it.
Yeah, it's been like very, very special and dear to me work.
What about you, Brenton?
I think like course of things is kind of similar to Chelsea's, because I also began on CAHOOTS as a crisis worker, and I still often like prefer to work in that role. Though I guess I like doing everything, and I like I just if calls are interesting, if calls are meaningful, if calls are exciting, like I want to handle them, even if they're regardless of whether they're more mental health or more medical. But I volunteered for Whitebird before I worked for CAHOOTS. I also volunteered for some other like community organizations. And then I got hired into different positions at Whitebird. Usually kind of like sort of case managey, kind of receptionist, like kind of I had different roles at Whitebird. And then, and I did all the different classes Whitebird had to offer. There's like basic crisis intervention, advanced crisis intervention, counseling theory and practice, suicide prevention, et cetera. So I did all these classes that kind of like qualified me for CAHOOTS to an extent. And so at a certain point, I was encouraged to work on CAHOOTS, and so I did. And then I was, working with medics. I was working with people that were, had whatever level of EMT training, some people that were in paramedic school or had just graduated from paramedic school or about to go to paramedic school. And, so then I had that exposure, and I thought, like I got more interested in the medical stuff. And, and there's people on CAHOOTS that are, so you have like your crisis workers that just like kind of lead mental health interventions. Then you have your medical people that lead medical interventions. And then you have a lot of stuff that's kind of like, either person might take the lead on, but there's a lot of people that are cross-trained, that can work in either capacity. And that allows you to like work with anybody. So you have like a greater range of partners, and just allows you to have this like more versatility on the job itself. So I wanted to get cross-trained. And so I did an EMT basic class. I did an EMT intermediate class. And then I got trained as a registered nurse So yeah, CAHOOTS exposed me to a lot, and created a lot of helped me, made me interested in new things, and just kind of opened a lot of doors for me.
You two both have really powerful stories, and the work that you're doing is so powerful and impactful. And as we're kind of wrapping up the end of this interview, I just want to give you the opportunity to really, if there's anything more you want to share with listeners, as this is an opportunity for you to educate people who are listening. I mean, there's been a lot of education happening with what you've been saying, but if just there's anything you want to share, now's the time.
Yeah, I think this work can feel really challenging on some days because it feels like we are just another piece of the system being so many things, whether it's like really institutionalized mental health care, that sometimes the best option we have is the room with 4 white walls in the hospital, or the calls where it was hopeful that CAHOOTS could come up with a different outcome, and then things went sideways on scene and it resulted in arrest. Those situations suck a lot of the time, and they happen in front of us. But what is really immeasurable with our work is the really benign stuff. Like, I don't know that if the welfare check on the person on the sidewalk, bringing them to the sobering house, that could have been the time that they got hit by a car, a drunk driver, or that could have been the time that they got woken up by police aggressively and got really aggro and got a ticket or had a violent encounter that resulted in some prison time or some sort of serious charge, or could result in death. And I think in Eugene, we kind of have this funny dynamic where people call non-emergency too much because they're trying to access CAHOOTS too much. And for those subject down calls, like we have all these good-hearted liberals who are driving into work and they're like, oh, I see somebody sleeping. The first thing that the call taker says is, okay, can you tell if they're conscious or breathing? Oh, no, well, I'm too afraid to check. So that call has now just bumped up to number one top priority call for the whole city, frankly. If we're not available, they might send police because police have Narcan, police have an AED in their car. And more times than not, that person was just sleeping. And that is their best option. And so just like challenging people to be really critical of that thing, like, is this an emergency for that person? Or is this an emergency for me? Does this make me feel uncomfortable when that person might potentially be living like this every day? And that goes to things like suicide too. It can end up being really isolating and stigmatizing if somebody confides in you that they're feeling like they want to hurt themselves, and you pick up the phone and call 911 first thing without asking more questions, because for them, they might have these thoughts every day of their life. And they're like, whoa, I disclosed to that person that I'm experiencing this, and I'm so weird that they had to call 911. So just like challenging people to recognize in those moments, to just kind of like take the step, assess why they might be reaching out for the external response, and consider the risks. Of course, for different neighborhoods, different responses happen. So somebody swinging a bat in a park where we're down the street from the Mission and the Sobering Center, CAHOOTS might come. Somebody swinging a bat in a park of the Southwest Hills of Eugene that's a lot more affluent, they might get every cop car, lights, and sirens. And those outcomes look really different. Obviously, advocating for in your community for non-enforcement responses is the dream and the hope, but the small moments are the really meaningful things in our work. And also those small moments can be done by anyone.
Yeah, it's I wish I had some really wise things to say, but this work, it's really emotionally, morally, intellectually challenging and complicated. I agonize over these questions like all day, every day, about like what the solution is to these issues. And one thing I think about is on the one hand, like I think like CAHOOTS is this radical kind of like, it's cutting edge, it's innovative, it's like unique, and it is like it's kind of this thing. It's like its time has come, but so like on the one hand, we are like there is a certain amount of like social transformation that comes with it, and there is we do definitely, we save lives and we improve lives, and we improve the quality of our community, but we're also not like dealing with, whenever these articles about like CAHOOTS is a solution to homelessness and stuff like that, I'm like, we're not a solution to homelessness. Like, what are you talking about? Like, there's all of these, like, we're not doing anything to like we make the lives of some like unhoused people better. We maybe, lessen the burden of like homelessness on the community to like in certain ways, or, and we can handle these problems in place of other organizations that are maybe more expensive or less sympathetic to them or whatever, but we are kind of like the police and kind of like the fire department and the emergency room to a large extent, just kind of like we're a crisis service. We're putting out fires, and without necessarily dealing with the like underlying problems, so like CAHOOTS should be franchised and exported and molded to different communities all over the country and all over the world. But but there are these just deeply seated problems with our society, and until those are addressed and remedied, there's the need for things like CAHOOTS is just going to continue to grow.
Absolutely, yeah. I think you did a really great job explaining that it's a crisis response to human responses to deep structural and systemic problems, really. And as long as those problems exist, there always will be a crisis.
Yeah.
But you help to address that crisis in a much less harmful way, a much more supportive way. And, I want to just thank both of you for coming on the podcast and for doing the work in the community.
It's an honor.
Thank you.
Thank you for listening to Doing the Work, Frontline Stories of Social Change. I hope you enjoyed the podcast. Please follow on Twitter and leave positive reviews on iTunes. If you're interested in being a guest or know someone who's doing great work, please get in touch. And thank you for doing real work to make this world a better place.